Good morning. I didn't fly back from Sydney, but I did fly back from Texas last night. For some reason, it felt like the same distance. It's an honor to be here this morning to speak to you. And I know that my communication leader who's in the audience is very concerned because I don't have any notes that she made sure that I had the facts straight. You have to understand, in my new role, incoming chairman and CEO, I'm starting to feel like maybe people have some questions. She sent me a text when I was sitting down, and she said, walk up the stairs to the right. I was thinking, what did she think? I was going to just jump on the podium and come up here and talk to you, but so I'm a little concerned about how they're feeling about me. We were together yesterday in Texas, since I mentioned this to you, and this is a true story. And I was there to give a talk, and we were in the car on our way back to the airport, and we were trying to conduct business, and the nice driver kept interrupting us, and he made me think about San Francisco. Because the first time he interrupted us, he said, "Excuse me, I'm really sorry to bother you, Mr. Tyson." He said, "But look over there, that's a new road that we're building." And I looked over there with Donna, and we looked, and all you can see is dirt and mud. And then I looked in the outer bounds of the area, and there was nothing there but dirt and mud. And he said, "We're going to build this road under the highway." And I said, "Woo." And then I thought about our majestic Bay Bridge that's being built, and I was thinking if he was only in San Francisco, he probably would try to drive on that bridge right now. He would be so blown away about the beauty of it. But that speaks to the city that I want to talk about just for a minute, the beautiful, beautiful city of San Francisco. And the thing that's unique about San Francisco is we all have a story that we can relate to about San Francisco. I have many stories because I've had the privilege of living here twice now. I've worked in San Francisco. I started my career at Kaiser Permanente in San Francisco on Gary Boulevard. I was living in the East Bay, and we also live in the East Bay, and I met this beautiful, beautiful woman who is now my wife, going on 4 years. And we were dating, and the first time I drove her to my home in Pleasanton, we arrived at the house, and she said, "Wow, you live a long ways from San Francisco." And then I said, "Actually, it's not too far." She said, "You are about one exit away from being geographically undesirable." So it was on after that. And then when I asked her to marry me, and she graciously said yes, and I actually took her to Hawaii. I had to bring it on after that. I took her to Hawaii, and she said yes. And we started talking about the wedding and everything, and I said, "You're going to love living here in Pleasanton." And she said, "Wow, we're going to live in Pleasanton 24 hours a day, 7 days a week." And I said, "We don't have to." She said, "Good, we should also live in San Francisco." So we're back in San Francisco. I can't tell you how honored I am to be given the confidence and the trust of my board of directors to be named as the incoming chairman and CEO of an organization that I love dearly, that in its core, in its DNA, and everything that we do is based on a simple philosophy, which is we believe accessible, high-quality care should be afforded to everybody in our area and in this country. I wake up every day and I am amazed at what I see in the four walls of Kaiser Permanente and in this country around issues of health care, issues of individuals not having access to, as I call it, to go through the front door of our healthcare industry. In this country, you are guaranteed care if you need it, but we all know that means you generally go into the emergency department, in which it's 3 to 10 times more expensive, and usually by that time, your illness has progressed to a level that it requires more time and attention. So it is incredible for me as one of the leaders in the healthcare industry to be a part of and providing leadership to a great organization whose mission is aligned with what we need to get done in this country on healthcare. It's unaffordable, it's unattainable, it's questionable with the results that we are achieving in the healthcare industry. And let me be clear that I am not indicting the men and women who are working every single day to provide the highest quality care possible to the millions and millions of people who need us in the healthcare industry. In fact, I'm often struck, and I mention this quite often, I can guarantee you that as I am privileged to stand here and speak to you for a few minutes, right now, in one of my emergency departments, right now, while I'm talking to you, in one of my emergency departments, someone is on the edge of death, right now. And they are in the great hands of the people of Kaiser Permanente. And by the end of today, they're going to either be in our hospital or they're going to be on their way home. Right now, while I speak to you, someone is just about to get their chest cracked wide open. And in the great hands of our doctors and nurses and others, they're going to get that surgery, they're going to get sewn up, and in the next couple of days, they'll be on their way to full recovery. And within the next hour, unfortunately, someone in one of our beds, according to our statistics, will probably pass away during this day. And in the great hands of the caregivers, we will be there to comfort them and their families through this time of bereavement. So it is serious business what we do in the healthcare industry across this country. We by far spend more money per capita for every individual for healthcare in this country than any other country in this world. Almost $8,000 per person in this country. And yet the results of what we get in the industry and in this country, the life expectancy of an average American is about on par, a little better than Cuba. So we have a lot of work to do. And I can't tell you a better place to promote working together with the great people of San Francisco, the great businesses of San Francisco, the mayor and others in San Francisco who get it, who understand change must happen for the better. And as I close, we're privileged to care for over 200,000 San Franciscans, and almost 3.5 million in the Bay Area, and 9 million across the country. 9 million across the country. I love to say this with competitors in the room. If we were a state, we would be number 11 in this country. And even though we have 200,000 San Franciscans, we have room for 1 more, 2 more, 3 more, 4 more. So I'll sign you up outside if anyone wants to try us out. Last but not least, In this great city, we love to talk about the wonderful things that we all can relate to, the restaurants, the teams, the Giants, and the 49ers, and others. And by the way, the 49ers was simply delayed 1 year from the next trophy that we're going to get. When the lights went out at the game, I ran around the house yelling, "That's our sign. We're going to win now." But next year will be our time. This is a city of winners, of achievers. We, as my communication leader likes to say, we lean forward in San Francisco. We make it happen. I travel all over the world. All you have to say is, "I'm from San Francisco." And somebody will either tell you a great story of something that happened to them while they were in San Francisco, or they will fantasize of what they plan to do when they get to San Francisco. That's how wonderful and precious this piece of the rock is on this earth. And I can't tell you how wonderful it is for me to share a few moments with you who helped to make it all possible. Thank you very much.